It is my honor to invite our chief guest, Dr. Julius Ogato, representing the Acting Director General in the Ministry of Health. Dr. Ogato, welcome to give your remarks.
Thank you, Professor. Professor Michael Gisheru, representing the Vice Chancellor. Professor representing the DVC, Research and Innovation. Dr. Darius Shahinda, Dr. Sachita Shah, Dr. Kevin, Kenyatta University Management, the Dean School of Health Sciences, the Directors of Health Services from the counties, the representatives of various professional organizations, ladies and gentlemen, good afternoon. It is my pleasure to be here representing the Director General in this important occasion of launching training in portable ultrasound scanning here at the university, taking the trainees from various counties where access to care and diagnostic services is for sure limited. To bring into perspective the launching we are doing here today, I want to inform this gathering that in as much as Kenya is one of the low-middle income countries, we are leading in a few innovations in the healthcare industry. A case in point is the portable eye examination kit, which has been pioneered here in Kenya by Dr. Langat in Trans Nzoia district, and we are scaling it up. It is an innovation that is using the technology we have, the smartphone, using the human resources we have, the teachers, with basic minimal training, to examine the visual acuity of children and pick those children with impaired vision who need specialized care and do the necessary referral. And this is what universal health coverage is all about. And Professor, I'm challenging you that we have got technology with us, and being the in charge of innovation, I want to bring to your attention and attention of everybody here that we've got children and adults as well who have got impaired hearing and use hearing aids. But once a Good Samaritan has donated a hearing aid and the children have enjoyed hearing, then after a short while, the battery runs out and it is not cheap. Then the children become deaf again. And remember that impaired hearing separates you from society. You can't hear, you can't communicate. But then, all of us here have got a smartphone and we got Bluetooth earpads that we charge maybe every day or every alternate day. It is not rocket science using Bluetooth earpads to assist children with hearing impairment to be able to hear continuously, because we use a smartphone in any place in the country. This is to you, Professor. In the past, for those who grew up in the 70s, blood sugar check could take upwards of 4 hours to get a result. It was really hard science. That could only be done by somebody who is specifically trained to do it. And optimum requirements were needed. Currently, blood sugar check is a 30-second activity which is done even here in this room. Chances are somebody has checked his blood sugar. You do not need training, special training out of the ordinary things we do, like using a mobile phone. If you picture this, you are walking in KU. During the day, you use your eyes to see where you are going. And it is easy, no problem. Now picture this. If all of a sudden it is pitch dark and you can't see nothing, how do you get to where you are going? Under the current circumstances, you call somebody who is several kilometers away to come with a torch and tell you, now start describing, you will move this way, and you go this way, count 50 steps, turn left. After you turn left, go this number of steps, then you are going to reach your hostel. Now, if I give you a torch, you shine a spotlight, then there you are able to get your direction. This is the situation clinicians find themselves in. You are seeing a patient and you are in a dilemma. Is this baby viable or not viable? So you have to send to the other end of the hospital or to another facility for somebody with experience in ultrasound scanning to confirm that for you. But then, if you have focus, there you are. Like it is pitch black, I give you a torch, you find your way. This is what point of care services are all about. Whilst today we are talking about point of care ultrasound, as a university in the area of innovation, we need to look at how we can harness the technology that we have to improve access of care to the Kenyans. Look at a situation like this. A patient somewhere 1,500 miles from Nairobi needs critical care. The anesthesiologists, about 80% of them are in Nairobi. Is it possible that we can leverage on technology and use the ventilator and the monitoring equipment in the remote area to access this patient care? I want to say the answer is yes. During the COVID pandemic, this was an innovation in India that was used to access critical care services to thousands of people within the first country. Can we do it in Kenya? Yes, we can. Do we have the technology to support? Yes, we do. Do we have the human resources to do this? Yes, we do. Now, Professor, what is our problem? because a Mzungu has not come to tell us that we can do it. I want to tell you, we can do it without being told. And the Ministry of Health will support you with any innovation that will for sure bring services closer to people, and not just bringing services closer to people, but innovative services that will improve health outcomes, as measured by improvement in life expectancy, or simply put, reduction in premature deaths. And we know what our health policy target is that by 2030, we need to have increased the life expectancy of Kenyans from the current 66.7 years to 70 years. Since healthcare is capital intensive, is human resource intensive, without leveraging on technology and innovation, we cannot achieve these targets. You know clearly that the other policy target we have for 2030 is to reduce the total number of years lived with disability from the current to less than 5. Currently, as it is, in the life cycle of a Kenyan, the total number of years a person lives with a disability is about 10 to 12 years. If you take into account that about 20 years you are in school and growing, and by 66.7 years you are gone, if you minus the 10 to 12 years that you are having some disability cumulative, then you see the number of years a Kenyan citizen will be productive is much reduced. Therefore, it is incumbent upon our institutions of higher learning to come up with innovative solutions that will reduce the cost of care, that will bridge the gap in human resources for health that we have, that will improve access to quality care, that will reduce the exposure to unsafe practice, and assure quality care to our patients. And Vice Chancellor, sir, count on the Ministry of Health to work with you in this journey, and we are looking to our universities to assist us come with these innovations. So with those few remarks, allow me to read the speech from my Director General, Dr. Patrick Amoth, who, because of exigence of service, could not be able to be here with us. Let me take this early opportunity to thank Kenyatta University, Butterfly Network, and the Global Ultrasound Network for partnering in Point of Ultrasound training and the deployment of 500 Butterfly IQ Plus ultrasound probes and iPad devices to the Kenyan healthcare workers. On this, we really want to appreciate as the Ministry of Health. Kenya is among the countries with maternal, reproductive, and neonatal health challenges. And we know that despite the lot of investment the government has put in the last 10 years, including raising the number of health workforce by about 70%, we still have challenges in accessing specialized services because we are far off from the UHC requirements. And this is evidenced by the fact that in the last 10 years we haven't made very good progress in terms of reducing neonatal deaths. We have only come down by about 2, from 25 per 1,000 to currently 22 to 23. But we have made significant progress in reduction of under 5 mortality from a high of 50-something to around 30-something. We have done very well. But in neonatal care, neonatal mortality, we haven't done very well. In maternal deaths, there's been significant, but we are way off the 2030 target. So we need innovative ways of addressing the specific challenges that we are facing in improving maternal and neonatal outcomes. Whilst point of care ultrasound scanning availability is not the magic bullet alone, we know that there are other innovations that we need to address to improve on access to emergency neonatal care and emergency obstetric care. And some of them do not require a lot of investment, and we count on our institutions of higher learning to come up with these local innovations. For you know that sometimes you cannot bring innovations from the high-income countries and copy-paste them into our situation because they do not take into account our cultural dynamics that are key in determining healthy outcomes. As you are aware, the global conversation now is to accelerate efforts to end preventable maternal deaths and neonatal deaths. Therefore, concerted efforts are needed for this to be actualized through collaboration of stakeholders at the national level, county level, and facilities level, not forgetting the role the non-state actors play in improving health outcomes. The status of maternal and neonatal deaths is indeed not business as usual. There is need for extraordinary interventions from the usual strategies. Interventions that improve the quality and standard of care at reduced costs with improved access in terms of time and geographical access. We cannot talk about innovations without talking about health outcomes. These innovations must contribute to improved health outcomes and must be accessible both geographically and financially. Evidence indicates that the majority of neonatal deaths occur immediately to a week after birth. Most of the causes are complications of labor and congenital defects. But we know clearly that complications of labor are manageable. Complications of labor are preventable. And taking into account that there is no country that has adequate health workforce, then it follows that we have got to re-engineer our clinical practice and use the health workforce that we currently have. And we have got to re-engineer the supervision and the matrices of measuring the quality of care that we have. We cannot innovate in service delivery without innovating in measuring the quality of care. They must go hand in hand. What effectively I'm saying is that while we embrace point of focus, point of care ultrasound scanning, we must also come up with innovative ways of maintaining standards and regulating this task-shifted responsibility. Basically, what we are discussing here is task shifting and task sharing in improving access to diagnostic ultrasound. Evidence indicates that majority of neonatal deaths occur immediately, and I've said this can be prevented. And one of the methods that can do this is access to diagnostic services, like the point of care ultrasound scanning. The other recent innovation, which everybody is aware of, fortunately it doesn't require much training, is blood oxygen saturation levels. Remember those days, taking arterial blood, sending it to the lab, waiting end on to be told what is the level of oxygen so that you can take an intervention. These days, it's just one touch. Remember the days when we were doing bilirubin levels. Getting blood from a neonate is not an easy task, especially a premature. This is where you need to do bilirubin levels. These days, it's just one touch, you have it at point of care. Colleagues in the university, these are the kind of innovations we are looking forward from you that are reliable and affordable and easy to use. For these concerns to be addressed, emphasis on ensuring universal health coverage is the main call. Access to essential obstetric services depends on the health facility, the provider, the client, and the supporting infrastructure. However, the improved technology services have been brought closer to the people with increased connectivity with the technology, as I've just said. And this improved connectivity is what we are using in point of care ultrasound scanning when the frontline health worker cannot for sure say what you are observing, then the specialist who is remote from where the patient is, the images can be beamed direct and can give support to the frontline health worker to maintain the standards and the quality of care. Therefore, the rolling down of this training project is a perfect example of the collaborative engagement between the care providers and the innovators in the same field, creating perfect synergy towards favorable obstetric and child outcomes. And that is our core business as the Ministry of Health, improved health outcomes. As we envision having every woman and every newborn provided with quality care with the aim of standardizing care for childbearing families, the county and the national governments look forward to partnering with the healthcare providers for the delivery of quality maternal services. Today, we celebrate all the reproductive, maternal, and neonatal healthcare providers across the country, and we call upon the health professionals, education institutions, professional regulating bodies, and all the stakeholders to stand for the mother and the baby and take lead in advocating and maintaining the highest quality standards of care in maternal and neonatal health. What effectively we are saying that we are not training frontline health workers for purposes of improving their earning power, but we are training them for purposes of improving the health outcomes of our patients. Allow me to thank the team who are responsible for this training that seeks to promote continuing professional development, in-service training, and clinical mentorship. Such opportunities provide learning opportunities and sharing of new evidence to improve the quality of care towards improving health outcomes. Further, I take this opportunity to thank you all, especially Kenyatta University, for hosting this training that seeks to improve access to diagnostic services, and I hope that it will not be limited to point of care ultrasound scanning alone, but can be extended to the other services that we need to access people. I welcome you all and wish you fruitful learning sessions and a good way to stay and work in your counties. Thank you, and may God bless you.
Thank you very much. May we be upstanding for 10 seconds and clap for the chief guest for the speech delivered. Let us appreciate him. Thank you very much. Before you take your seat, sir, we want to invite you to unveil the banner. May we all be seated. With the rest of the team members on the high dais, kindly accompany the chief guest, Dr. Bergman, Professor Gisheru, and Dr. Darius. And so it's a moment to unveil the project officially. If we can, there's no gender balance here, but it's all right. If we can have 2 on one side and 2 on the other. Oh, thank you, Liz, for the dean and the project lead. Sachita. All right. I hope our photo men are ready to capture the moment. Our chief guest, it's your moment now, sir, to unveil the banner of the project. Let us appreciate him as he does that. Continue to clap until it's all unveiled and clear. Those claps don't sound like happy people. Thank you very much, our chief guest. The banner reads, Kenyatta University in partnership with Global Ultrasound Institute and Butterfly Networks, launch of Point of Care Ultrasound training and deployment of Butterfly IQ plus devices to healthcare practitioners in Kenya, supported by Bill and Melinda Gates Foundation. A better